Dear fellow Rotarians, warm greetings to all of you. I am Ramesh Hariharan, your district governor. As you know, one of the 6 areas of focus for Rotary is disease prevention and treatment. Our work in the area of polio eradication and many other diseases is well known to all of you. We have formed a task force to combat coronavirus. These experts have been working round the clock, gathering invaluable information for the benefit of our district membership and the world at large. This town hall is a sincere attempt to share with you their knowledge and to address some of your questions. Kindly note that we'll be addressing only those questions that are related to prevention and treatment. Welcome to our online town hall webinar with our panel of experts to discuss the challenges our communities are facing as a result of the spread of coronavirus. Over to the chairman of the task force, a member of the Rotary Club of Los Altos, Dr. Jack Higgins.
Thank you, Ramesh. I am, in fact, a family doc, practiced in Chico for 20 years. And then when I came down here, I started doing some different things involving 3 nonprofits, working with Rotary Club of Los Altos for the last 20 years, but also with Rotacare Bay Area free clinics and with a project started in Los Altos Rotary around AIDS, currently working on preventing transmission of HIV from mothers to babies in Africa and in Asia. And more recently, also working with the Global Telehealth Network, volunteer doctors who are seeing patients in underserved areas, or actually seeing health workers who are taking care of people in underserved areas to help them out when they need a consultant. But now we're focused almost entirely on this thing that has hit us, this coronavirus pandemic. And here we are talking about that today. And I want to welcome all of you here to join us in discussing this. And we're going to talk a little bit among ourselves. Each of the 4 experts on our panel will give just a brief presentation, about a few minutes each, and then we'll go to Q&A. And that's the idea of this, is to have it be a town hall, have it be something where you can ask the questions that you have. A number of people have already asked questions when they registered, and we'll be happy to answer those. We'll be interspersing some of the new questions as well that you're writing now in the chat box. As you put a question in the chat box, we will get it, and somebody will feed it to me, and I'll try to ask it, and we'll get through as many as we can before the end of this 90-minute period. I want to talk a little about the disclaimer here. This is something that was in the invitation that you all got to invite you to this webinar, and I'm not going to read through the whole thing. That's I heard a few gasps of relief there, but I want to point out that this is something that's a legal thing that we really need to say. But it's also just really important for you to understand that things change quickly, very quickly right now with this pandemic. We don't know what the truth is about many issues. A lot of things that we think now are true, that have a consensus medical opinion, will turn out to have not been correct. A few days from now, a few weeks from now, a few years from now, we just don't know. So you want to base decisions that you make on advice from your doctor if possible. And if your doctor's not available, it's worth calling the nearest hospital or the county hospital where you reside, or call 211. And I want to point that out because it's something that's new to me. 211 is a number that's available now for sort of general advice for people who are feeling like they need help, whether it's finding out more about COVID-19, or finding out where testing might be available or how you can get it if it's appropriate. We'll talk about that too as we go here today. And it's a place to ask somebody a question without calling 911. They are going to be overloaded for sure. If they aren't already, they will be soon with emergency calls. So don't call 911 to ask about things that are not quite that urgent. But if you think you have a medical emergency, by all means, call 911. Don't call the district office. Don't call your doctor. Call 911 and get help. So with that, I'll go ahead and introduce the first of our panelists, Dr. Richard Godfrey.
Thank you, Jack, and good afternoon, fellow Rotarians. I'm really pleased and honored to be part of this webinar. I've been working with Niles Rotary for some time. I was previously with Kaiser Permanente and more recently with the East Bay Surgical Residency at Highland Hospital. I'm just going to mention briefly experience I had almost 5 years ago in West Africa when I worked with the Ebola virus. And I'll just share that those were very tense times, particularly in that part of the world. And we came together. It was looking very, very dire. And thanks to the help of Partners in Health and International Medical Corps and Doctors Without Borders, as well as CDC, WHO, and many organizations, we came together. And by January of 2016, we were on the downslope. So hopefully we'll be approaching something that is going to take this virus out of our everyday, every minute lives. Maybe we can show that next slide on the PowerPoint. And this just gives you an indication that we're really getting started now. As you can look at this quickly at the slide, you see the different counties in the Bay Area. And clearly Santa Clara has been hit the worst, but we're still in what we might call the early stages of the surge. So it's going to be a marathon, not a sprint, but I hope we can answer some of your questions today, and thank you for this opportunity.
Thank you, Richard. Next, I'd like to introduce Dr. Peter Sherris.
Hello. I am the current president of the Rotary Club of Oakland. I also practiced with Kaiser Permanente for 35 years. After I retired, I went and got a master's in public health at UC Berkeley, which has proven to be quite helpful in analyzing and thinking about this public health emergency that we are currently in. I also am a director at TIBA Foundation, where we're building a community-based healthcare system in Kenya. And I've been very proud to work with Rich, who I have referred many patients to as a surgeon who comes and works with us. I'm going to go ahead and share my screen at this point. One of the questions that I get the most is, how long is this thing going to last? And what I'm demonstrating here is a graph. There we go. Anyway, what I'm showing here is a graph of total deaths in the United States of America. I'm going to try one more time to get this interaction to work. It did earlier. But anyway, if you look at this graph, it shows that there's a steadily increasing number of deaths. Right around April 1st, you'll see that there's a solid orange line that turns into a dotted orange line. The solid orange line are actual deaths. And the reason I want to show this is because this is demonstrating that we are really just at the very, very beginning of this epidemic. If I now scroll up, what we're looking at here is a graph you'll see later that has to do with hospital use. Hospital use in this situation is a pretty good indicator of just what's going on and how sick people are. You will notice that we're just at the beginning in the United States of hospital use, and it peaks out around the middle of the month. Now, in California, we actually got started with social distancing. The data that I'm showing you depends on us maintaining social distancing throughout the whole epidemic. And if I go to California, you will see that that curve flattens out and becomes lower. And but it still shows that the peak of our epidemic is going to be towards the end of April, and it isn't until around late May or early June that we're going to get to the point where the number of cases has fallen enough that we can begin to think about easing our social distancing. I know the president told us that he's going to, as of now, at the end of April, we will consider dropping our social distancing. But I can tell you that if these curves are accurate, and so far they're spot on, that is going to have to be delayed. So with that, I'll stop my screen share and we'll go on to the next presenter.
All right, technical difficulties. Couldn't find my unmute button there for a moment. I want to point out again that if you want to ask questions of any of our panelists, simply go to the chat box. You should find on the bottom of your screen there, right across that bottom border, it says chat and there's 3 little dots in a balloon. That's where you can go to ask procedural questions if you like, but also to ask questions of our panelists. Just type them in there and they'll feed them to me and I'll try to ask them on the air here. So next I'd like to introduce Dr. Art Dover.
Hello, can you hear me?
We can.
Good. I'm Arthur Dover, retired pediatrician. I spent some time with the Epidemic Intelligence Service at CDC in parasitic diseases. I've had some overseas medical adventures, and I am a volunteer at our local Rotary Care clinic. I wanted to talk about the position of children in this outbreak because there is almost nothing available on the news that I've been able to see. So I've gathered some information I'll pass on to you. Journal of Pediatrics published quite recently an article describing documented infection in 2,100 children. There was 1 death, and they considered that only 6% of those children were seriously ill. There are other studies showing children not even being included in the count. So children generally are not significantly affected by this. My point that I want to make is that it's their caregivers who are at risk from the children. The children are vectors that can transmit the virus without being sick. This probably happens very, very commonly without testing. We have no idea how often it does happen. The transmission is not just by mucus, coughing. It's been shown in stool. There's a recent pediatric meeting at which 6 children were described who were ill with documented infection. They presented with diarrhea, not respiratory symptoms, and the coronavirus was found in the stool. So it's an added risk for people who are having close contact with children. And I also have some interesting suggestions for dealing with children by age group that I'd like to summarize for you. For children below 4 years of age, they really can't understand the virus. This is an invisible threat. For them, we need to talk to them about hand washing, keeping their stool in the proper place, telling them that shelves might be empty because there are other people that are having trouble finding the food, although we, in our situation, do have adequate food supply for them. This is for age 4 and below. For 5 to 10, grade school kids can understand these explanations more readily. They need to know that this is a serious problem that is going to pass. This is not forever, and they are protected by their caregivers. And then the more difficult group is the preteens and adolescents that don't have the frontal brain well developed yet. They have great difficulty in practicing social distancing. They should rely upon their electronics and not insist on gathering at close quarters with their colleagues, with their peers. I hope that's information for you that is useful for going forward. Again, the children are not going to be seriously affected. It's we who care for these young people who are at risk. So again, I recommend the standard recommendations: hand washing, social distancing. Thank you.
And thank you very much. Next, we'll go to Aggie Freeman.
Hi, I'm Aggie Freeman. I'm a registered nurse. I work at the University of California Medical Center statewide. I'm also the club secretary for Rotary Club Silicon Valley Passport, and I've been serving this year as the district sergeant at arms in District 5170. My specialty is occupational health and how an infection like this would impact employers. And I also do case management. Next slide, please. So we've been talking about social distancing, but the most important impact we can have as Rotarians, as individuals, is to stay at home. You can go to the grocery store and order food delivery. You can go out and get medications or have them mailed to you, as well as other supplies that you would expect to get at a pharmacy. You can go to the bank or the post office. You can contact a plumber, electrician, or bug exterminator. You can go to the gas station or auto repair shop. And if you're in the essential group, or if you have to use public transit to do the things I just mentioned, you can do that. You can take a walk, you can ride a bike, and you can drive, all while social distancing, which means 6 feet apart. And to get a picture of what that looks like, if you extend your hand out and the person you're facing extends their hand out, that's probably close to about 6 feet. Under the current guidance of Governor Newsom, you cannot hold a gathering larger than 10 people, either in your home, in the park, in the playground, or anywhere else. We're asking, and the governor has signed an order, as I understand the city of Fremont just did, on hoarding or overbuying supplies. People who used to be buying for 1 month are now buying for, or 1 week at a time are now buying for 1 month or several months. And we're asking people not to do that because there is not a problem in the grocery supply chain. By order of the governor, there's no bars or clubs that are open, except restaurants can receive a phone call or an online email to use Grubhub or some form of delivery food to go. You cannot go to a gym, a theater, a bowling alley, an arcade, or any kind of music venue. You cannot dine in at the restaurant. Playgrounds I mentioned earlier, playgrounds, it's very difficult to maintain the 6 feet diameter. You cannot go to a non-essential retail store or to the mall. And you cannot do any activities that could put the seniors at risk who have underlying conditions such as diabetes. Always practice staying 6 feet away and wash your hands before eating. Next slide, please. So Dr. Sherris, who showed you the slide statewide earlier from the same source that I'm using here, was talking with you about the peak. This is the view in California. The purple line that goes across your screen is the number of beds available in the hospital. And the goal is to keep the number of patient admissions below that purple line. So the large purple hump you can see hits in California somewhere around April 24th, we expect, in about 28 days from now. And the dotted purple line is with the interventions that we have been doing at by Governor Newsom's executive orders. Our goal medically is to keep the number of inpatient admissions below the line of the number of available beds. If you've been watching the news, you're seeing New York City is very much being challenged by that the numbers of patients exceed the numbers of available beds. So they brought in the USNS hospital ship, which is one in New York, one in Los Angeles, to supplement beds for non-COVID ill patients. So we know that there are 3 groups of patients. There's the population who is infected, and there's the population that needs hospitalization. So this slide is talking about the numbers of patients that need hospitalization. Thank you.
Thank you, Aggie. We're calling this a town hall because instead of having a lot of long presentations, we had those short presentations. My intention was to keep it down to about 20 minutes, and we made it in 19 minutes. We're doing really well. And the idea now is to have all the rest of the time available to us to handle questions and answers. So it's up to you now. We had a number of questions and answers as people registered, and we'll be taking your new questions to the chat room now. And Gibson, I think, is great to answer the question. And if one of our people among our panelists, please add on. We'll start with a question that came in earlier this morning. Our kids are home from school. How do we protect our kids, and are Playdates okay? Dr. Dover, you're a pediatrician. Why don't you take that one?
Playdates are rather risky situations, and I don't know there's any really good way to deal with this. I can read something from the Week magazine for you very briefly. Consider the risks, first of all. When kids are out of school, they need to socialize. If none of your families are at high risk, they're probably fine. Yes? Can you hear me? Hello?
Art, you're fine. Please continue.
Did you hear me?
Art, you're fine. Please continue.
Oh, okay. Keep the numbers low for the play dates. When possible, keep the kids outdoors to lower the risk. But as you heard from Aggie, going to playground is not a good idea. Indoor parties with lots of people, birthday parties are not recommended. Talk to other parents, make sure they understand all the precautions, and sanitize all the play spaces. I myself would not encourage a play date for anyone. It's hard enough to control one toddler or preschooler. Thank you.
It appears that Jack may be having trouble with his bandwidth.
Let me try going on to one of the next questions that was put forward to us. Peter, can you hear me okay?
I can hear you fine, Rich.
So one of the questions is, I've heard that everyone should behave as if they have the virus and that they should stay away from others in order to protect them. Is this a good suggestion for how to modify public behavior? I'm just going to point out the obvious, which is that viruses don't have legs, they don't have wings. The only way they can move around is when we move them around or other vectors. And so it's, I think, common sense now to all of us that we have to take social distancing as our greatest, probably combined act, social distancing to 6 feet. If you haven't had your influenza vaccine, particularly if you're of an older age, but for any of us, it might be a good time to make sure you have that. Wash your hands at least 20 seconds and more is probably better. Stay away from anyone that you think might be carrying the virus. That's just common good sense. As the governor's telling us, the conditions are what we have, but the decisions that we make, we're going to be making every day, and just making good decisions with good judgment is what makes sense to this particular question.
I agree with you, Dr. Godfrey, and I'd just like to tag on to that as a community of Rotarians in the public domain, what we're going to do is act the way we would for influenza, with good hand washing. Just don't be around somebody that's sick. The challenge with the COVID virus, COVID-19, is we have a very limited number of diagnostic tests. We have no vaccine. And even though there's research being done worldwide on how to treat this with therapeutic medications, we currently don't have a protocol to treat this. So what's really important for our Rotary community to know is that social distancing and staying at home and preventing the infection is the way to treat it. And Rich, if it's okay with you, I'll take the next question.
Great.
In the distant future, when Rotary meetings can be held in person again and we have a lunch, do you think we'll need to insist that every attendee verify they have immunity or have had the vaccine when it's available? Do you suspect teleconferencing may be the only option in the next year or two? Well, as the governor's district sergeant at arms and as someone who's been working with the facilities over the year, Rotary clubs do follow the guidance of Rotary International. We follow the guidance of the district governor, 5170, and we, in this situation, also follow the guidance of the Centers for Disease Control, our governor, who is the head of the public health department for the state of California, and our county public health department where our club meets. We continue to have the option of meeting online and using several available platforms to do that. There is support in the district with resources, individuals who are very experienced doing this, and it's not likely that we will expect to see COVID-19 testing or mandatory vaccination proof because of the HIPAA constraints, the privacy constraints, any more than we would expect to see when you sign in for Rotary proof of your flu vaccine shot. So we would do the same things we would do for the flu. Stay away from someone who's symptomatic, stay home when you're sick, get the influenza vaccine now if you haven't already that is available for you, and wash your hands before eating. Thank you.
Yeah, so this is Peter. I actually have the next question, but I'd just like to support what both Rich and Aggie have said. One of the really good pieces of news about this virus is that even though we want a 6-foot distance between people, we know that it actually takes fairly prolonged exposure to someone who's infectious to get it. So you're careful in the store, if you're staying 6 feet away, if you're washing your hands very, very carefully, the prognosis is excellent. So my question is from John Weaver, my good friend, a member of the Rotary Club of Oakland. He says, can we now or soon identify persons who have recovered with antibody tests to see if they're immune? The answer to that question, John, is yes, that test is not available, but it is going to be extraordinarily important to figure out just who has had this virus, because there are lots of people out there who are asymptomatic that don't know they've had it. And what we're hoping is when we find all those people, we're going to realize that this bug has got a mortality rate of 1% or less. I'd like to just briefly talk about the accuracy of the current test we have, which is testing for the RNA of the virus. If you go get a test, and it's only going to detect the fact that you're infected about 70% of the time, it is not a perfect test. In fact, in the hospital, they test people 3 times in a row, and if they get one of them being positive, they believe that that person has COVID. The other thing is that if you get a negative test, that's only about 80% accurate. There's still a 20% chance that you have this virus. So the testing we have isn't that good, and it needs to be done under the advice of a doctor. Nobody currently is recommended to get this test who doesn't have symptoms. And I'll just say, you also asked, John, about the effectiveness of serum and hyperimmune globulin. That's all being studied.
Peter, I think the next question goes to both Aggie and to you.
Shelter in place. Aggie, why don't you take it?
Thanks,
all right,
Peter.
Aggie.
Can you hear me?
I can.
Thanks, Peter. Shelter in place is a necessary medical strategy to slow the spread of the virus and is also economically devastating. World Health Organization says rapid testing is needed in conjunction with social distancing to identify mild or asymptomatic persons spreading and carrying the virus. Do you believe testing is a paramount need? So from a medical perspective, testing is needed in the hospital with patients who we are treating. We need to know for 2 reasons. We need to implement the correct treatment plan. We need to monitor them carefully. We need to put them in rooms so that they don't spread COVID to other patients who are not infected. And we need to protect our staff. Testing also tells us, and it will tell us, who's recovered from the infection. So there's 2 types of tests. There's the type that tells us who's infected, And there's also the type of test that tells us who has recovered. And that's important for a number of reasons. There are some opportunities through the American Red Cross, for example, for people who have recovered from the infection to donate immunity. So the shelter in place will help prevent you from getting infected. The testing will be available through your doctor and through the public health service for people who are symptomatic. The medical piece is we don't feel that everyone who wants a test needs a test because it takes, at this point, they're not available for all the population who want them. Peter?
I agree wholeheartedly. I don't have anything to add.
Aggie, I just want to also to answer a little bit of the question that came from Dr. Shorey, who's a dentist and obviously is concerned that we are on top of all the things that we can do. Governor Newsom has a conference that comes out on the radio at noon every day, and it's discussed these issues of testing, how long it will be before we have adequate amounts available, and what the goals will be. So I just want all those that are interested in this particular subject to know that he's making a pretty good effort to get that information out, and he's doing it on a daily basis at around noon.
Thank you, Richard. It's Jack again. I'm sorry. I live on the edge of the continent here, north of Half Moon Bay, and the internet sometimes drops out, which it did just now. So I'll jump back into the conversation. And Dr. Shorey had another question. What can we do to be able to get back to work prior to having a viable vaccine? Who wants to take that one?
Yeah, this is Peter. I can take that. The answer is going to depend on what happens to the total disease burden. We've seen those graphs where things are going up and up and up and then coming down around the end of May. And the answer is going to be that when the amount of the disease and the transmission of the disease is down to a level that's low, then we're going to, and when we increase our testing, we identify the cases that have the disease, we're tracing their contacts, we're quarantining everybody, best to be quarantined away from the family since 80% of the transmission of this disease is to family members. Then we can start letting people who are immune, people who have negative tests, people who haven't been exposed to others who have this virus, we can start letting them go back to work.
Thank you, Peter. Dr. Shorey had one more question, and this is partially answered, I think, but Aggie, maybe you could say a few more words about his question, which is, if you believe rapid testing is needed, what can our communities do to help facilitate making this a viable objective?
Well, one of the things at UCSF that I'm seeing that's very inspiring is that the research which began a month ago on having a test for inpatients at UCSF has been rapidly accelerated through the FDA and approved. So there is research going on among the worldwide community on this virus from the testing standpoint, from the therapeutic medication standpoint, and to come up with a standard algorithm for treatment at various levels, starting with home care and going through to the ICU. So as each of these tests become approved from the FDA, we'll see an opportunity for more patients who want to be tested to have that resource available, either through their primary care doctor or through their doctor's office. And the news is changing so fast. I understand even today, Abbott Testing has come up with a rapid test that gives results in 5 minutes on a doctor's office piece of equipment that it was previously used for influenza and some other diagnostic tests. So the information is changing very fast. So stay going. I think one of our concerns medically at UCSF is people are getting their information from sources that are not the CDC, the Department of Health, or their family physician who knows their history. So we would encourage you to go to the district website and look at some of those sources that we've placed there for you and to continue asking questions. Thanks, Jack.
Thank you, Aggie. Let me ask you another one that's related. How do we serve those who are gripped with fear about this crisis?
So the best way to manage fear in an epidemic is to know the facts. And right now, the important thing in the facts are that we're going to treat this like influenza. So if you get the flu, what do? You stay home, you take your temperature, you hydrate, you use Tylenol if your fever's elevated, and you reach out and let your physician know. At this point, according to the history we've gotten from the virus in patients who've recovered, is that would apply in about 80% of the cases. If you become rapidly short of breath, if you have an unmanageable fever, and as Dr. Rich would say, if your lips turn blue, it's time to head over to the hospital. But we would like you to call us at the hospital because there is a triage nurse. There's also a triage nurse in many of the doctor's offices that can give you specific advice. Consider video visits or telephone visits, which many offers provide them. And if you're not urgent, if your in-person visit is not urgent, reschedule that to a routine time. As you may know, all of the elective surgeries have been canceled at most of the facilities in the Bay Area where I affiliate. So stay at home, practice social distancing, get the facts. And my grandmother would say, if you're nervous, do something with your hands. So bake a pie or do something in your family, with your family, to distract yourself. I don't think watching the news and the daily counts is really helpful to manage the fear. Thanks, Jack.
Aggie, if I could just add the caveat, if your lips turn blue and you're not using blue lipstick, call 911.
Thank you, Rich. Just for that, I'll give you another one. For Rich, is there a point in the condition that I must call my doctor? At what point are things, short of having blue lips, at what point should I call my doc or somebody?
You're
still
muted,
on,
Rich.
Sorry, Peter may want to take that one on, and I'll just add what I think all of us in Rotary know. If you're showing any of the three major symptoms, which are going to include fever and shortness of breath or respiratory symptoms or malaise, those are the three most common initial symptoms. But as we know, you can have this virus with no symptoms, but when you need to be contacting your doctor is generally going to be from good common sense. And Peter, maybe you can give more detail to that.
No, I agree, Rich. I think that, if you're at home and especially if you've been exposed and you have a fever and you're a little bit malaise, otherwise not feeling bad, call your doctor. If you get a cough or if you get short of breath, you definitely need to call your doctor. If you have mild symptoms, you're almost certainly going to be told to stay at home and call back and when things get worse. But it never hurts to call your doctor, or I happen to be a Kaiser doctor, call the advice nurse. They're going to give you good advice. They're going to reassure you. And so don't hesitate to call. But don't call 911. That's totally swamped. They can't handle it. So try to disperse those calls through the medical system.
I agree with both of you, Peter and Rich. The other thing I would like to add is this is a really good time if you're not already online with your healthcare provider. I know KaiserKP.org provides a resource for that. UC provides one. Sutter Health provides one. If you're not already online, get connected that way because you can email your doctor through their online public portal. And if you haven't done that already, this is a really good time to do that because those concerns are available. And when you call, you're very often going to get in connection with an advice nurse who can help you. So it's never wrong to call the doctor.
And I'll just add briefly that if someone communicates with you that is concerned and you want to help them and they don't have a doctor, they're not able to reach their doctor, we have availability of good advice for the county symptoms. Remember that number, 211. If I don't think any of us Rotarians are homeless right now, I hope not, but if you dial 211, that will put you in contact. You'll get a large amount of messaging before you get to a human being, but they have good people to help us out.
Jack, I was wondering if I could take on the household pet question we have in our Q&A.
Absolutely, go for it.
Yeah, so Michael Deering has asked, can household pets carry the virus if exposed by a human carrier? So the answer to that is that currently we don't believe that household pets actually become infected with this virus. Certainly, if they come in contact with someone who has the virus on their hands, they get petted by someone who has the virus on their hands, it's conceivable that their surfaces may be contaminated. And so show good sense, wash your hands carefully after handling your pets, especially if they've been out of your sight and in places where you don't know. But we don't think pets get this virus.
Thank you, Peter. I want to make a mention here of something that I just learned, which is that if you're asking questions in the chat, they may not get in the lineup very quickly. And instead, it's better now to use the form that's in the chat room, the tiny URL number. So try that. If you have another question at this point, please use the URL that's in the chat box. And then I have another question for Aggie. This is very specifically for Aggie, and I'll point out that it's from Judy and Mike Coleman of Niles Fremont. And they're asking, or saying, it's such a frightening situation to think of a loved one diagnosed with COVID-19 and taken to the hospital. You find you're unable to be at their bedside and maybe unable to communicate in any manner. As a case manager for UCSF, what key advice can you provide to us? Critical steps you can recommend we take to be prepared for that sort of thing happening?
Well, as you know, Jack, hospitals have been changing their routine visiting policies to protect both their staff and their patients from transmission of COVID-19. And it's estimated that COVID-19 is about 10 times, maybe about 10 times more contagious than influenza. So it's very likely that visitation at the hospital where a patient is admitted will be very strict, and in each facility, it will depend on the patient's condition as well as the policies of that facility. So they're trying to, in a lot of the facilities I'm seeing, they have safety checkpoint portal of entries where the access is very limited. The staff is stationed to conduct screenings. Some of them are even taking temperatures. They're directing people who have a cough and a fever into a separate area. And visitors could be, in some situations, limited to one person accompanying the patient or none, no visitors. So I think that visitors in most situations currently are discouraged. What you can do is you can make sure you have the current legal documents signed, the advance directive if you're the person who has the authority of making decisions, and to call the hospital in advance because the visitation policy may change daily. Discuss with your family member the plan if someone is in the hospital, who will go and who will be the contact for the family. And in one of my families, we had the one person designated to be at the hospital and visit, and then another person was making the phone calls and notifying the other family members. You can connect also with the inpatient nurse case manager or discharge planning and get daily updates. And you may be in a situation to have to accept that no visitation is one of the possibilities. I hope that answers your question.
Thanks, Aggie. Here's an interesting question, for me at least. I understand there's something called viral charge, which is a problem for health workers. Is there something like a small charge that might be innocuous? Anyone take that one? As I understand the question, that he is saying a small dose of exposure to virus might not be as much of a problem, and perhaps the more constant exposure that a health worker might get from multiple patients might make it more likely to get sick.
So I think I can take that from my Navy background. In preventing disease transmission, there are some specific things that have to happen in order for the infection to occur. So the virus has to be present. It has to be present in sufficient quantities. It has to get in through the correct portal of entry. And what we know about this virus, it's a droplet virus and it's inhaled. And the host must be susceptible. So we do know that if you get a small exposure, a small viral load, that your body may not become infected. That is one of the possibilities. We do know that this is a highly infectious virus, and we've heard that many times people over the age of 60s and people who are vaping and people who are diabetic are much more susceptible. So I think all of our healthcare providers who are in the ICUs, they're getting daily doses, daily exposures of this virus, and they certainly are more at risk. So all exposures do not result in infection, but it is an infectious pathogen that we have no antibiotic for and no vaccine for. So we want to protect ourselves by preventing by continuing the social distancing. Peter, do you have anything to add?
Sounds good to me.
Yeah, thank you both. Here's a question from somebody in my club in Los Altos. She says, I've been told by my blood center at Stanford that they'll not be wearing masks while they take our blood. I understand the concern about availability of supplies, and I want to donate blood, but this seems like an unsafe practice to me. What are your thoughts and your advice?
I guess I can take that one. The blood donation centers have been extremely careful about their policies with regarding to patient safety. I know, for instance, that the Red Cross is not allowing any drop-ins. Everybody has to be on an appointment. We don't advise people who are asymptomatic and healthy to be wearing a mask. And part of it has to do with the fact that masks are in extremely short supply. So if the person who is taking your blood is working at a distance from you, it may not be quite 6 feet, but it's going to be 4. If they're not coughing, if they feel well, if you are feeling well, right now there's a tremendous shortage of blood, and it would be beneficial to actually provide that blood to people who need it. The older you are, of course, the higher your risk. So you need to take that into account. But they are being very careful with the blood drawing.
I'd like to tag on to that for a second to point out that one of the things that the task force is trying to do is help support the Red Cross and Stanford in their blood drives. There's been a tremendous shortage due to the fact that so many of the businesses and schools and churches and so forth where they have been usually doing their blood drives are closed. And they simply haven't been able to do many of them. They get canceled. I think it's something like 4,000 blood drives have been canceled. So somewhere in the ballpark of 100,000 units behind in terms of the blood supply they'd like to have. So if you are able to donate, please look at the websites for the Red Cross and Stanford and so forth. And as Rotarians, we're trying to help them find other sites where they can do blood draws. And if you can help with that, let us know. Richard, do you have a comment?
Yeah, just going to point out, this is a shout out to Ramesh, who provided around 1,500 masks that we helped deliver to the Tri-City Health Department and actually even out to some of the homeless community. The question of masks is probably going to come up quite a bit. The announcements have come up through the government that millions of the N95 masks are on their way. A lot of them are coming from different countries, including China. And some people are suggesting maybe they make masks using cloth. The masks probably are not harmful. If you cough or sneeze, they do give some protection to someone who's away from you, but they don't give you any protection that we know of right now. It's hard to have really good medical evidence for this, but there's no reason to think that they're going to give you adequate protection from the virus. And even the doctors working in the ICUs and the hospitals right now, wearing pretty good equipment, are unfortunately being exposed to the virus in ways that we can't always anticipate.
I agree with you, Rich. And I was going to say there are people that are making sewing masks that are providing those to their family members in the communities. So I'm not sure that those would have a great deal of value. Psychologically, I'm sure that they do give the person a feeling of comfort. But from our standpoint medically, the inpatient medical staff really is needing the providers and supplies. So we're hoping that people will continue to follow along and let those be available by not hoarding them and purchasing them. Thank you. Jack?
So this is Peter. So there is actually good evidence that masking of lots and lots of people for the SARS-1, remember SARS 20 years ago, and the MERS one, did seem to actually help reduce infection rates. Now, part of the way masks, as Rich said, the main way that masks work is when someone who is infected sneezes, it's collecting the majority of the droplets that they're producing. So that's probably the main way masks are working, not protecting the person who's healthy. The other way they work is they're a reminder to not touch your face. And so I think if you have a cotton mask that you produced or gotten from a friend, it's fine to wear it outside. It probably actually will make you safer. You won't touch your face. You'll wash your hands when you get home, and it's probably helpful.
I might add to that one of the risks of wearing the mask is that you sometimes will touch your face more to adjust it, and you have to keep that in mind as well. That if you're out walking around, going to the grocery store or whatever, it might be that if you have a mask on, you're going to be adjusting it and pushing it around and rubbing your nose through it and so forth, and actually have worse exposure because of that. So if you wear a mask, if you wear a homemade mask even, what matters a lot is how you use it and how carefully you are in addition to wearing that mask. It's not magic. It's not going to protect you without following all the other measures involved.
If I were taking care of a COVID-infected patient at home, I would be wearing a mask. Absent that, out in the community, I'm not sure that that's been really shown to be effective. Although if you look at the TV news in China, you'll see everybody wearing masks outdoors. So it may be a cultural thing there too. Thank you, Jack.
Yeah.
And if someone does have COVID in your home, they should be wearing a mask, because that's a major way it works as a protection.
Right. Thank you. Here's a question for Peter, I believe, asking how were the death projections made? Are they based on prior epidemics, and if so, which? And it seems like the number of deaths at the end of March could be half of what we're projecting or 10 times what we're projecting. So how reliable are those projections, and what's the margin of error? You're on mute there, Peter.
Right. Yeah, if you look at the graph I showed, there was a big shaded area, and that was the margin of error. I'd actually already answered that question and provided the evidence and the paper and their methods to the individual that asked that question. I'd be happy to provide that I'll put that in chat so that people who want to look at that paper can see how they did their projections. It's very sophisticated. It's a highly respected projection organization based out of the University of Washington.
Thanks, Peter. I think maybe you answered that one while I was offline there for a while, thanks to my internet carrier. Another question is, there's a person in the community that I manage who believes the response is overkill and refuses to abide by the distance rules. He continually approaches one neighbor and her young child, even though she's asked repeatedly to stay away. Can the sheriff be contacted to address this, or do you have other suggestions?
So that's a public health issue, and it's certainly a safety issue around the people that she's in contact with. I would call the county public health department and share that information. If there's a family member in her world that you can connect with, but I can tell you that denial is part of this illness. There are many people who don't think they can get infected. They don't think it's going to happen to them, and they're not mindful and respectful. So the burden's on us to show that as a role model, and we're not going to be able, I think, to convince everybody to do what the governor is recommending by executive order. So I would say call that into the public health department.
Thanks, Aggie. Another question, we've been talking about older adults getting flu vaccine, even if they haven't already done it. It's much later than we normally would do that. And the question is it worth leaving your home, stepping out of shelter in place in order to get flu vaccine?
I probably should try to answer that because I did put that out in an earlier discussion point. I think that, again, you can go through your physician or your advice nurse to best answer that question. And flu vaccines are offered through the pharmacies, which have remained open. Again, how do you get that? With social distancing, somebody's got to administer the vaccine. And it was brought up earlier that not everybody's wearing masks when they do that. So you can always request that. You can use hand sanitizer. And if you go into a pharmacy that's crowded, you might want to choose a time when it isn't crowded. Or if you're going to the hospital, you might talk with your advice nurse through the hospital as to when the best time to do that would be. And it may be that not all hospitals can offer that, but it most likely will be available.
I agree with you, Rich. I think it is not too late to get the flu shot if you're a senior at risk and you haven't already, but that's a really good question to either email or call your medical provider to discuss, who has all your history and your medical information.
One of our viewers is asking, how much validity do you place in the data from China, specifically about the return to activity in Wuhan? It seems like that's some of the most optimistic news we've been hearing lately, is that, well, gee, it's tapered off there. Is that for real?
Yeah, I'll take that one. So China's received a lot of criticism, in part from the politics. It's important that we realize that they reported this epidemic. And so the doctor reported the concern about a whole family that got this atypical pneumonia. 3 days later, the Chinese CDC reported this epidemic, or these cases, to the WHO. They have a huge incentive to get this right. They had 8,000 teams of 5 people each that were out trying to track cases, identify contacts, and getting them into quarantine. So I'm a believer that they are doing this right. I think they've actually done a way better job than we are doing here in the United States, because they've kept their epidemic to 80,000, and we're way over 100,000 now. So I think the Chinese are telling the truth.
Thank you.
Jack, can I add on just regarding that? An earlier question might have come in about hydroxychloroquine and hydroxychloroquine. Remember that the Chinese sort of recognized that first because they found that all the patients with lupus were not getting the virus. And so they deducted from that it might have something to do with the medication. Since they were on hydroxyquinine, they thought maybe that was an important factor. And so they did tests with that drug, which they've communicated in their literature, I think, in a fairly responsible way. And they did demonstrate, which we are now demonstrating in many hospitals. And a lot of this came out of France with Dr. Raoult. It's still early in the game. We still need to do good scientific testing. And at the same time, the FDA did very recently release hydroxychloroquine for use in hospitals. So we're seeing a lot of things that we can be thankful that all of these different countries are trying to provide the best information through good literature, good medical literature.
I saw something on the internet, which is fortunately or unfortunately the source of much of our health information these days, saying that perhaps the reason why we're not seeing as much COVID-19 happening in Africa and some other parts of the world where malaria is common, that the fact that they've been taking so much chloroquine for that protects them against COVID-19. Anybody want to address that?
Go ahead, Peter.
Yes.
Oh, I'm sorry.
I will. Chloroquine is out of vogue. It's been abandoned for use for malaria in Africa because of a very high rate of resistance.
So any that might have had would be pretty much gone by now.
Yeah, so that whole thing about malaria countries, not having COVID, I think that's sort of an internet meme that's been going around. I don't see that. There's just no evidence that countries like Kenya, which is where Rich and I work, are going to be spared from this epidemic. It's just that they are behind us. Their systems, their medical systems are far weaker. They're not going to be able to test. I think it's extremely unlikely that the fact that you are in a country that has had malaria is going to actually be spared this epidemic. Rich, do you agree?
I tend to agree. I want to add also that we've seen recently there's many 73 different drugs that are now being trialed and looked at in the acute period that we're going through. Hydroxychloroquine has been combined with azithromycin. Remdesivir is showing a lot of promise. So we'll probably just literally within weeks and maybe the next month or so find more of these that are being used on a compassionate basis and within good trials that are going to really be helpful.
Thank you. A little bit different direction. Someone asks whether the polio infrastructure that Rotarians have helped build, that is Polio Plus, will it be used to help stop the spread of coronavirus?
Go ahead, Peter.
Ramesh, you want to take that one?
Yeah, I would like to take this one on. I asked this question to Rotary International President Mark Maloney during one of the calls, and he written to me this letter today afternoon. I won't read that. We can be proud. Oh, let me get my glasses on. Hold on a second. We can be proud that in the ever-connected world of global health, the polio infrastructure that Rotarians have helped build is already being used to address and stop the spread of the new coronavirus, in addition to serving countless other health needs. In Nigeria, Pakistan, and Afghanistan, where polio personnel and assets have a significant presence, workers from the Global Polio Eradication Initiative partners are engaged in surveillance, health worker training, contact tracing, and more. In 13 countries, polio volunteers have been deployed to address COVID-19 preparations and response. I think we have every reason to be proud to be Rotarians who have helped the formation of this infrastructure. By the way, this infrastructure also was useful in stopping Ebola a few years ago, and it's also coming into play for stopping cervical cancer in Sri Lanka and other countries. So that is the answer. And as Rotarians, we can continue to help this polio infrastructure, maintenance of this infrastructure, and make sure that some of these epidemics that come, the pandemics which come, will be erased from the planet, thanks to our help.
Ramesh, I'd like to tag on to that because there's lots of communication from Rotarians that are asking what Rotarians can do. And one of the things Rotarians can do is donate blood through the American Red Cross. Another they can do is they can donate to the Rotary Foundation, which is supporting these kinds of movements. And the clubs are coming up with some very creative ideas on how they can support members of their own clubs that are isolated and need support for groceries and that kinds of thing. So we're excited about what we're hearing from our Rotary community. But I think today I got a notice from the American Red Cross that people that are documented as having recovered from COVID-19 can donate plasma, and that plasma can be typed in cross-match and given to someone who's severely ill. So I would say donate blood, and if you can't donate blood, then be an ambassador for someone around you in your family who can donate blood. There's an app in the App Store that says Blood Donor. You can download it and register yourself online. And we're excited to hear from you, the Rotary family, any other creative ideas that you're having to support our community in this time. Thanks.
Thanks, Aggie. Another question that relates to Rotarians helping came from our friend Ray Larson in Half Moon Bay, who's with IEEE, the engineering group, the international group with about 400,000 members. He called my attention to an article in MIT News that just came out, I think, a couple days ago, about an MIT-based team that's working on rapid deployment of open source, low-cost ventilators. We hear a lot about the fact that there just aren't enough ventilators in the world or in most of our cities to handle what we expect to be the peak in terms of ICU cases and people on ventilators. And they've designed open source something that takes the ambu bag, the little bag that you see people squeezing in the movies when they're doing breathing for somebody, whether it's the anesthesiologist during surgery or an emergency situation. It's like a little robot almost that squeezes an ambu bag. So it's very inexpensive to make, someplace around $100 to $200 instead of the $30,000 that the ventilators cost now. And Ray is wondering whether any Rotarians might be interested in trying to put our heads together and find a way to help accelerate the process of developing something like that, a very low cost respirator or ventilator that could be available perhaps by the time it's really needed in developing countries around the world. Anybody want to talk to that? Yeah, Ramesh?
So that seems like an engineering question, not a doctor question. So I'm an engineer, maybe I'll address that.
Right.
So I think Ray is part of the Institution of Electrical and Electronics Engineers, which is a large organization. But I also saw in the news yesterday that there's a company called Bloom Energy in San Jose who are manufacturing these units at a very short notice. The mayor of San Jose and the governor of California were there to witness this event. I think lots of engineering innovations are coming to play where these things are quickly produced and deployed. I just want to cooperate with IEEE for their thoughts, and we'll be very happy to collaborate with them. Thank you.
Unmute. Let's talk for a moment about a question from somebody about safety of food brought in from restaurants. Specifically, the surfaces the food is made on, stainless steel tables might not have been fully cleaned. Unknowingly infected worker might have touched the surface, cardboard boxes the food's placed in. There was a terrific video that went viral on YouTube, put together by a family doctor in Grand Rapids, Michigan, who went to the same med school I did about 18 years later. And he did a terrific job of explaining how to use sterile technique, basically, that one learns in first year of med school to make sure you're not spreading bugs from one place to another. And he demonstrates how to keep the bag. He put a tape line on his counter and had one side was dirty, the other side was clean. And actually, I'm doing the same thing. It works pretty well. So you bring in the contaminated, potentially, things from the outside world, and you get rid of the external bag. Instead of eating out of the containers the food came in, you dump them onto a clean plate, and so forth, and wash your hands a whole lot. And in fact, then you can almost eliminate any risks there would be in bringing something home, either when you go to the grocery store or when you're ordering carryout. The food itself apparently is not likely to be a vector for carrying the COVID virus. So the food that's inside that package, especially if it's been cooked, and it's probably preferred at this point to order things that have been cooked rather than not. If you manage your technique very well in transporting those to your clean dishes, chances are you're going to be fine. And I can't remember exactly where that YouTube thing is, but if you just search for, Dr. Jeffrey Van Wingen, that's it. Jeffrey Van Wingen is the doctor. So search him on YouTube and you'll find that. It's not perfect, but most of his suggestions are pretty good. Peter?
Yeah, I was just going to say one of the pieces of really good news about this bug is that it's incredibly sensitive. I mean, just 20 seconds of soap and water is it disrupts it. It can no longer infect you. Certainly anything that's cooked, it is not going to survive that. Even the concern about it on being on surfaces, if you pick this bug up on your hands on a surface, if you just wash your hands, you're not going to get infected. So by simple techniques, simply following the rules, you can markedly reduce the probability that you'll get this bug.
Thanks, Peter. Another person asks, I have canceled my dentist appointment. Should I reschedule? or wait for a while, like
I'll
6
take
months?
that one. I'll take that one if you don't mind, Jack. So the
Right.
California Dental Association sent out a communication to all of their dentists to cancel their appointments. First of all, because they can't maintain the 6 feet and practice dentistry. And secondly, because they're in a high risk group because of the proximity they are to the patient. And in the absence of testing, we can't tell the dentist the patient's not infected. So even though a dentist in the normal course of his business does wear PPE to provide dental care to protect him from you and you from him, the California Dental Association is going to be the one who's going to finally make the call on when it's safe for the dentist to resume their practice. So I think as far as the routine stuff goes, I would think by the fall, we could be looking, by September, we could be looking at a safe time. But I think there are dentists that are doing emergency care if you break a tooth or you have an injury involving a need to see them. Thank you.
Thanks, Aggie. Another person's asking, he says, we have a family living in our neighborhood and everyone has been fully home quarantined for 14 plus days. Our only contact with the outside world has been through deliveries. Are we safe and legal to see that other family in the neighborhood? Peter, you want to take that?
Sure. I am a strong believer in maintaining social distancing, sheltering in place, and that means that we should not be going out and about in our usual social situations. I mean, one thing I can think of is that if you go visit another family, you really don't know whether or not they have been following sheltering in place and what they've been exposed to. We are all in this together. We have to work as a team. We've got to get that infection rate down, and the only way we can do it is by social distancing, keeping the schools closed, keeping businesses closed, and reducing our travel.
Thanks, Peter. Someone else is asking, they're stating first, he assumes that some communities in California will be affected more adversely than others, and some communities will be in crisis. Can you identify such vulnerable communities and advise as to what Rotary Clubs should be doing now to support the medical efforts in such communities?
Well, we know that the farmers aren't having a high rate of infection in our densely populated areas, first in Washington State, New York State, and now Louisiana, who have the high density activity, Mardi Gras, are infected. So what we will be doing is we will be, as the tests roll out, we will be doing testing. Right now we're doing mitigation, and so I think we're in a different phase. Peter, I'll ask if you had something to add on that.
Sorry, I was distracted for a second.
Peter, I'll try and answer. The question is, do we give special attention to high-risk communities? I think one of the lessons that we're going to be getting out of this process will come from New York, and particularly we're going to rapidly increase our ability to detect and test for future viruses. Remember, this was all anticipated long ago, that with SARS and MERS and Ebola and other viruses, we knew that we would be encountering something, maybe not on quite this level of a pandemic, but we knew these viruses are going to come back, and in fact they have. And so that being said, coming back to that question, I think we will come up with better modalities with which to test out and identify certain communities that need special supervision or surveillance. On the other side, we have a lot of liberties as Americans that we want to protect. And we see different examples, whether it's Taiwan or South Korea or China. So this is a balance, but again, technology is evolving very rapidly, and it will allow us to try to hopefully respond in a quicker fashion when we need to.
Thank you, Rich. Another person asks, I was told that washing hands before eating is not as critical since the stomach kills the virus. Is that so? And this would seem to go along with something that at least 4 different people have sent me about drinking huge quantities of water, because if you wash the virus into your stomach, the acid will kill it. And I think this is part of the same theory. Who wants to handle that one?
Yeah, I'll take that. So there was this whole thing that came out over the internet about drinking frequently. I don't know that it had any basis in medical fact. It's certainly true that if the virus ends up in your stomach, it's going to be destroyed by the acid in your stomach. But on the other hand, it's passing all of these susceptible cells on the way down where it can grab. So I wouldn't pay attention. The key to this is what we've been saying all along: washing your hands 10 times a day. That's going to mean you're going to be washing your hands before you eat. Of keeping a social distance from people, and if you do that, and you're going to be able to markedly reduce the risk that you're going to pick up this virus.
Thank you, Peter. Someone else points out that she's concerned about people who have no symptoms that might affect others because they have the COVID, but they don't know it. And she's asking, why do some individuals get symptoms and others do not?
Well, we have this thing called an immune system, and the immune system is very strong in some people and not so strong in others. For example, people that are getting chemotherapy don't have a strong immune system. Children's immune system haven't matured as much as adults. And we know through strong medical evidence that older adults who have been smokers or are diabetics, their immune systems aren't as great as they were when they were in their 30s and 40s. But if we look at the numbers in California that are posted on the website, this virus is able to infect all comers. It's just that the way that some people respond to it presents a very severe illness and ends them up in the ICU, and some can be managed at home through home care.
Maybe Art Dover can add a little bit to that, because as he pointed out earlier, children can be vectors. One of the other symptoms that we've been seeing or hearing about is anosmia, in which you lose your sense of smell and taste. And those people, sometimes when they get tested, it turns out that they were carrying the virus. Art, any thoughts on this?
Yes. First of all, the infective dose that one receives may make a huge difference in whether they become ill or become a carrier, or the virus is just destroyed, taken out of action by the immune system. We don't have universal testing, so we know almost nothing about asymptomatic carriage of the virus. And this, I think, is perhaps especially true for the situation of children who no doubt have been exposed to many adults who are contagious and infected, and the children are getting the infection but not getting sick from it.
Yeah, this is Peter. So the loss of smell and taste is actually seen with lots of different viruses, so it isn't surprising that this one might cause those same symptoms in someone. Doesn't necessarily mean that you have coronavirus. If you have that, you could have multiple, there could be multiple other causes as well.
A somewhat related question is regarding symptoms that are typical for coronavirus. And she says there are a few symptoms that aren't included on the World Health Organization or CDC websites. Wondering about conjunctivitis and low-grade fever. Low-grade fever. Are either of those associated more or less with coronavirus?
Well, yes, there has been cases of conjunctivitis, and viruses don't really like fever, so very often the fever will be subnormal or low. When it spikes to 103, your infection system, your immune system is activated and is really manufacturing the defenses against the virus.
Thank you. Another person asks, how should we handle exchange students who are trying to return home? Should we suggest they remain in place here or try to find a way to return home?
That's got to be handled on a case-by-case basis. Ramesh?
I think we are following the guidelines from the Rotary International. First thing is the children who have gone to other countries. We are following their desires, their parents' desire, both sides of the world. The Rotary Club, which has sponsored them, both sides of the world, the Rotary districts and so forth. But overarching to all of this is the governmental regulations. If the government says we should have these students back, we shall have them back. So that's a hierarchy of decision making that we're trying to do, and we're trying to be as rational as possible.
Another question, unrelated to the previous ones, I think, is a person suggesting that there's research evidence showing that one of the factors that seems to inhibit the growth of most other coronaviruses is warm, humid weather. And she's asking whether there's been any discussion of using warm, steamy methods to help prevent and treat COVID-19, as well as common colds.
We just had a very interesting article coming out from a expert in immunology reviewing all the different cytokines and basically defense factors from macrophages through monocytes. And the previous studies have shown that, as Aggie just pointed out, sometimes fever is our immune system kicking in to control a virus. So there are actually some studies using hyperthermia. I'm not sure I would want to sit in a sauna too long and rely on that as treatment. In fact, I know I wouldn't rely on that, but it's a fascinating area of research. And I did a lot of work with hyperthermia in my early years, and it'll be interesting to see where that leads.
Thank you. How likely and or when do you envision people will be able to get out of their homes and even safe and comfortable going to large scale events like concerts, especially older adults? Any guesses there?
Yeah, I mean, I already presented some of that data. First of all, those decisions are going to be made by public health authorities, both county, state, and federal. As you saw the graphs that we showed, the infection rate is not really going to come down in April. It's probably going to start coming down in May in most places. Not true overseas because they're just starting their epidemic. But we're in this for the long haul. When are we going to be able to start having 100-person meetings again? I don't know, but it's going to be at least a couple of months off in my opinion, but you'll have to wait for the advice from the authorities.
Thank you, Peter. I want to ask, we're getting close to the end here. I want to ask all the panelists whether there are other questions they spotted on the list here that we're all looking at that they'd like to answer, or any of the comments that you want to make.
Yeah, there's one that I saw from an anonymous attendee. Any thoughts about the risks of an asymptomatic couple in early 70s having dinner at home with an asymptomatic family member in late 70s with diabetes? Again, I believe, and you've been asked to do social distancing, and I think it's worthwhile postponing that kind of an event. But they have a second question, which is it safe or reasonable for an asymptomatic family member to drive a family member in the late 70s to a medical appointment? That is a permitted part of our shelter in place. If you have a family member who needs to get to a medical appointment, yes, you can take them. Aggie, do you want to follow up on that?
I agree with you. Medical appointments are good. They're okay. I'd still put the person in the back seat and have the ventilation going in the car, have the windows open, but I would not encourage a high-risk person who has diabetes to have dinner with anybody. I would focus, the group on what we do know, because we're learning a lot about the virus. We do know the incubation period can be anywhere from 2 to 14 exposure. And we do know that the presenting symptoms are frequently headache, cough, and some type of fever, sometimes as high as 103, but over 101. The evidence is building that it is a droplet transmission. We've learned a lot from China. We're learning a lot from Italy. And there's research going on at a very rapid rate of speed. And as Peter was talking to, if we stay home, then we're not going to expose the 2 to 4 people and continue to transmit the infection. And that's what it appears to have happened in some of those cohorts of infection that we're seeing in New York, Louisiana, and Washington. We know the severity of the disease. About 80% of the individuals who receive the infection and get ill will have a moderate flu-like illness and recover at home. It's the ones who need the hospital that are presenting the biggest challenge for us medically. And we do know that after the person has the virus, that it takes 2 weeks to recover, and that they may still have active virus for as long as 30 days, although we're not sure that that virus can be causing new infections. Rich?
One of the other questions that came up is regarding how to there's a glossary of common medical terminology. And for example, I would just remind everyone, what does SARS-CoV-2 refer to? And that's severe acute respiratory syndrome, coronavirus 2. So it's not the first time we've had a coronavirus. We've seen quite a few, but this one's a noetic one. We think it originated from the bats, and it goes to your respiratory tract and really creates havoc. So that's the 20% that end up in the hospital, and out of those, some will end up on ventilators because it really does damage to the respiratory system. But we're gonna get on top of this virus. It's gonna take all of us working together. So I'm just pleased to work together with this group and with all Rotarians. One last thing is, any of you out there that are nurses, the governor did make a request today. If you're interested, sign up for, what did he call it? healthcorps.ca.gov. They're looking for volunteers for the surge ahead.
Yeah, this is Peter. I also am happy to work with you guys. And the Rotary Club of Oakland is having our remote meetings. We are having a cocktail party with me, president of the Rotary Club, on Thursday night at 5:30. Go to the Rotary Club of Oakland page. We have a link there. We'd be happy for you to join us and have a little remote cocktail. And be sure to let us know you're visiting, and we'll say hi. And we'll do our typical Rotarian approach to life.
And thank you for all your questions. For the people that are listening in today, we know we're not going to get to all the questions on the list, but if you'll check the district website in the days ahead, we'll do our best to post them.
I want to add that we hear a lot about social distance, and I prefer to call it physical distance. It's critically important to maintain that physical distance, but we want to avoid emotional distance in these times when it's so hard to get together. We need to keep maintaining social interaction and emotional connection, because that's really important to get through all of this. Phone calls, video conferencing can make a big difference. And meanwhile, the work that Rotary clubs do is so important that we can't let that stop. We can't let a little thing like the global pandemic stop us from doing the things that we do as Rotarians in terms of our projects. We started doing meetings like Peter's doing in Oakland. We started 2 weeks ago, so this will be our third meeting this coming Thursday. So we didn't miss a meeting at all. We didn't have to go dark. There were people in the club who were saying, oh, we'll have to go dark until this is over, maybe 2 or 3 months. And we decided that just didn't make sense for our own health and for the work that we're doing in our community and around the world. So I encourage people in all your clubs to keep things going. A Zoom subscription rather, costs $15 a month. And we're using one subscription for all of our committee meetings as well as for our meetings every week. And we had over 80 people at each of our first 2 meetings so far. So even the folks that aren't very used to computers can learn. And we have a set of tutorials on our website. If you go to Los Altos Rotary Club's website, on the right side, you'll see a column that includes a little button that says, something about video meetings, I think. Yeah, it says video meetings. And if you click on that, it'll take you to some of the tutorials we've developed and some we're developing still that'll be up there soon that tell you how to schedule a meeting, how to run a meeting, how to be in a meeting, how to have your guest speaker run their own slides from their own home. It's all very handy, and it's all free and available for you folks, so feel free to grab it from there. And with that, I'll turn it back over to District Governor Ramesh.
I'm very happy that this town hall webinar went so well. I would like to thank each one of you on the panel, Dr. Peter Sherris, Dr. Richard Godfrey, Dr. Art Dover, Dr. Jack Higgins, and nurse specialist Aggie Freeman to be on the panel. There are a lot of people who helped this behind the scene. I'll give a special shout out to Rushton Hurley from the E-Club, who managed this entire technology for us. It's been a great learning curve for us. I hope you all benefited by this webinar. I hope you can spread the message that Rotary is here to help, Rotary is here to inspire people, and Rotary connects the world. Thank you very much and have a great evening.